To the FCT now, as health workers in the Federal Capital Territory wants the free distribution of the micronutrient powder to be included as part of routine immunization for children nationwide. They made this call at the closeout of the community component on enhancing infant and young children nutrition in Nigeria. Helen Osamide Akins reports.
Malnutrition is a direct or underlying cause of 45% of all deaths of under 5 children. UNICEF reveals that Nigeria has the second highest burden of stunted children in the world, with a national prevalence rate of 33% of children under 5. It is estimated that 2 million children in Nigeria suffer from severe acute malnutrition, but only 2 out of every 10 children affected is currently reached with treatments. To improve the micronutrient status of children in the FCT, Nutrient International through Plan International introduced the micronutrient powder in urban slums of Amak and Gwagwalada in the FCT through community outreaches in 2022. The nutrient powder is to be given to 55,000 children within 6 to 23 months of age.
Malnutrition isn't just a chronic problem, it is also an urgent problem. And which is one of the reasons why we try to support government and also use different means to be able to combat. So every day we look for better, faster ways.
In Nigeria, we recognize the fact that the level of anemia, and I'm happy that we have women around who also understand what anemia means to them. Blood shortage or blood loss is life. If you lose your blood, you are losing life.
As the program winds down, these stakeholders want it to be extended and call on the government to include it as part of routine immunization for children nationwide, following the benefits of the powder.
When the child is sick, the mother will not sleep, and we suggest that, yes, the father should not sleep also, because that is why in Nigeria there is now paternal leave to assist the mother in whatsoever.
We are not visiting our hospital before, but because of this micronutrient, they know where Gishiri PAC is. They always rush in, even ordinary day, asking us, what about that thing? What about that? They call it, some are even calling it teeth medicine.
The micronutrient powder is a combination of at least iron, zinc, and vitamin E used to prevent malnutrition in children and during emergencies.
The continuity of this program will not only see to it that more children in the FCT and the nation at large get the adequate nutrients needed for a healthy lifestyle, but we also ensure that the rate of malnutrition in the country reduce. Helen Osamide Akins, TVC News, Abuja.
And governments at all levels have been advised to partner relevant stakeholders in a bid to tackle poverty in the country. This formed part of discussions at this year's annual Lions Club Day with the United Nations, which held in Lagos. Speakers at the event highlighted the menace of hunger and poverty while calling on governments to do more.
The problem that is endangering hunger in Nigeria now as a focal point is big. It's big. So we need to really address it fast.
What we're trying to do here is to bring the effects of malnutrition to the front burner. That when people are malnourished, they have less productive capacity. And the children will not be able to learn very well.
Hunger is a real problem. People are hungry. The people who are in chronic hunger, more than 10% of the population, chronic hunger. People who are in hunger are much more than 30% of the population. They go to bed hungry every night. So this is a pervasive problem which needs to be addressed.
There's so many things that we need to fix along that route to ensure that as we produce, the food is actually able to get to people's tables at a price that they can afford. And that is a big issue where we need to address.
Stakeholders in the nation's film industry have called on young filmmakers to work on their craft rather than focus on the glamour